Hi, I want to talk to everybody today about the COVID vaccine and our coronavirus pandemic. As you know, for the last 18 months, we've had a miserable existence due to the coronavirus. It has affected all of us in many different ways. We've lost loved ones, we've had people who have been ill, and certainly it's restricted all of our lifestyle. I want to emphasize to everybody, though, this pandemic is medical. It is not political. This is medical. It affects your health. It affects your life. I wish it had not gotten into a political fiasco that it has. We now have this pandemic that is turned into the unvaccinated pandemic. And that's what I want to talk to you about. I've practiced medicine for 31 years. These are the darkest times that I've ever seen. Doctors and nurses have stood at bedsides, holding patients' hands, watching them die, watching them gasp for breath, and essentially we have had absolutely nothing to offer. There are medications that we can use to treat this, but they're not nearly as successful as preventing this in the first place. The first time coronavirus came through, it affected the older, more ill people. We lost many people in nursing homes. Now we have the Delta variant that's coming through. The Delta variant is much more contagious and affects much younger people, including our children. Remember, children less than 12 cannot be vaccinated yet, so this is a very vulnerable population. In our facility at Rockcastle, we are currently admitting a lot of 40 and 50-year-old people who have been very healthy and are taking care of themselves. And these people have become very ill. So the look of coronavirus has changed, and we all need to be very aware of what's going on in our nation. You know, before there's been many viruses that has affected the United States. Polio, measles, chickenpox. These were eradicated through getting vaccines, and that is the only way that we can eradicate this virus that's affecting us now. Does that mean that if you take the vaccine that you're not going to get the virus? Not at all. What it does mean, hopefully, is that you will be able to survive. You will become less sick and you will not be hospitalized, placed on a ventilator, or even die. About 90% of the people who are so ill at this point are people who have not been vaccinated. The hospitals are full. There's no beds. If you come to our hospital with a heart attack or a stroke, we may not be able to transfer you because all the ICU beds are full. So the ICU beds are full for two reasons. Number one, there's a lot of people who are sick. The hospitals are full of coronavirus patients, and these patients have a very long illness. So they're occupying those beds for many days. So now, the fact that those people in those beds are keeping other people from receiving health care. As a physician at Rockcastle, when we try to transfer people because they need to see specialists, we are told there's no beds. Try another hospital. Try another hospital. And sometimes there's no beds for up to 200 miles, and they also are near full and won't accept our patients. So it's time for us to do something so that we can take care of ourselves and take care of our loved ones. So I wanted to talk just a minute about people's worries about this vaccine. If we watch TV, if we watch the people on TV, if we listen to the news programs, or even just talking to people on the street, there are so many thoughts about this, so many truisms, so many false things. I wanted to address just a few of those. The things that we hear that people do not want to take the shots for. Number one, younger people are afraid that it will affect their fertility, that they won't be able to get pregnant in the future. This shot has been out now for about 10 or 11 months. I received my first one in December. There are no medical documentation that it affects fertility. What we do know is if you get the coronavirus while you're pregnant, you're more likely to have a miscarriage or to have a premature baby who would have health problems. The second thing we hear, I've had the COVID. I don't need the vaccine. We know that when you have COVID that you do develop antibodies, but it may not be to the Delta variant that's affecting everybody. So even if you've had the COVID, about 3 months after that, you need to get the vaccine. People are saying, oh, it's a new vaccine. They're going to wait to see what happens. The basic vaccine molecule has been out there for a long time. It's been used to treat other diseases, which are similar to this. It has been tweaked some, but this is just a little something new on something old. It has been out there. People are worried that if they do get the vaccine, that they're going to get an infection. The way this vaccine works, you cannot get COVID from the vaccine. Now, people will tell me that they get the vaccine and then a day or two later get COVID. And yes, you can do that because the vaccine itself takes 2 to 3 weeks to kick in. You can be exposed to COVID and contact that in the meantime. But the actual vaccine itself will not give you COVID. People say they have too many health problems. Very few people cannot take this vaccine. Very few. Talk to your doctor. They'll go through your problems. They'll go through your medicines with you, and they can tell you if you will be a candidate. Some people say they're too healthy. I don't need that. Remember, now the Delta variant is affecting young, healthy people and our children. People are worried about the side effects to it. We've all seen in the news where it can cause blood clots and heart disorders and other things. But we definitely know that if you have coronavirus, that you can get those things also. People that have coronavirus are more likely to develop blood clots, more likely to develop heart problems, and more likely to wind up on the ventilators, and more likely to die. Now, I'm not trying to frighten you. I'm just telling you what we as physicians are seeing, and it's very worrisome to us. Some people are worried that the vaccine will alter your DNA. Again, this is not possible given the way this vaccine works. Your children aren't going to have 3 horns, and you're not going to be able to pass this down. So it will not affect anything like that about you in the long term. And people are really worried that this is not FDA approved. It has been approved for emergency use. So what? A few people have not signed off on it. This has been given in millions of doses. People have received it. Overall, people have done well. And we know that the people that have received it do better whenever they get the Delta variant coronavirus. Now, does that mean that everybody's going to be side effect free? Obviously not. But we overall, from a medical standpoint, feel this vaccine is safe and could be life-saving. So now I'm going to talk to you about why you should take the vaccine. And I know that most people just think that I'm going to say you should take it to protect yourself. But you know, that's going to be at the very bottom of my list today. I want you to protect those people who can't get the vaccine. That's the people who are under 12 or people who are allergic. I have a 5-month-old granddaughter, and her only protection is for all of us to get shots and to be very careful where we take her and to be very careful about mask use. I want you to do it for every doctor, nurse practitioner, housekeeper, kitchen worker, anyone who works in the hospital. Every day, these people get up, they go to work, and they're exposing themselves to this disease. I myself have 2 children and a brother who are physicians. Every day, we all go out, and we just pray that we can make it through another day. Also, community responsibility. This is the first time in medicine that we've been called on to do something for each other. This isn't something that doctors are going to be able to take care of. We can give you the immunization, the vaccine, but you have to come get it. You have to love everyone like God told us to do. You have to love those people enough to want to protect them. Get the vaccine so that you cannot spread this terrible disease. We don't want to give this disease to our friends, co-workers, church members, children, or grandchildren. When you sit down at Thanksgiving and Christmas and you look around your table, you want all those members to be there. That seems very dramatic, but I think it's very true, and I think it's something that we all really need to think about. This will require us to do things to protect one another. Don't let anybody make you get the vaccine. You should want the vaccine for yourself. You should seek this out. You should take it to protect your family and everyone around you. You should protect yourself too, but more importantly, you should protect those you love. I personally do everything I can. I've had the vaccine, was one of the first people that took it. My first vaccine was in December, and I got my second one in January. I want to do everything I can to protect my family. I want you to do everything that you can to protect your family. I want to thank you for helping us to protect our patients and everyone in our community. If you have any questions about whether you are a candidate for this vaccine, just contact someone in our office, Rockcastle Family Wellness, and we'll be more than happy to talk you through this. I know that people are afraid of this, but I am afraid for you not to have it.